If it's been over a month since your knee replacement surgery and you're still having a lot of trouble walking on your leg or straightening your leg when you stand or walk, this could be one of those things that is really vital for your recovery, but may be neglected in a lot of therapy, which is actually hammering your quadriceps strength. So here we're going to go over a few exercises that actually apply a good amount of resistance that you can try at your home to basically build up that quad strength and get back to walking normal. I basically have this band wrapped around the back of my table. So in your case, if you have any bands from your therapy or just any laying around at home, you could wrap around a table leg, just something that you can provide resistance by kicking straight up like that. Now I have an attachment here that is towards my ankle, but it's giving me resistance as I kick up and really trying to get that knee as straight as I can when I get to the top of the motion. Now, what I want you doing this for, not necessarily that 3 sets of 10. If you can get tired or feel like this is really hard after about 5 to 8 reps, that would be ideal. That's a signal that your muscles are actually getting the stimulus, that they're working hard enough to grow and get stronger. Do this for about 3 sets of that 5 to 8 reps, getting a good enough amount of rest between each set so that you're able to basically fully recover and do it again on the subsequent sets. This is just a simple step-up exercise. What I have here is a lowered step. So this may be smaller than your typical staircase. What I'd recommend if you don't have access to this or a gym that has one of these is just getting a step stool that is smaller than average. So looking for something between 2 to 4 inches, depending on how much trouble you're having. If you feel comfortable in being able to get up the stairs using your surgical leg, then you could just use those. But if you're having trouble starting out because that strength isn't there, then I would recommend getting a lower step. But here, this is to signify a railing, something you're gonna hold on to for balance, and also a little bit of support if I need it. But I'm gonna try to use my hands as little as possible. And here's what I'm gonna do. Get my surgical leg up onto the step, and I'm really just gonna focus on lean forward, press up and drive through here, and then back down. And I'm just gonna repeat that over and over here, trying to, with control, step up, pushing down. I have my whole foot on the step, so I don't wanna be here where I'm kind of wonky, less stable. Get your whole foot on the step, pushing down. That's really gonna get this quad strength going. Progression here, again, 3 sets of between 5 to 8 reps where you're really feeling a challenge. If you stop feeling that challenge, what I want you to do is go up to a higher step if that's available, or just doing a few more reps. So you can get up to that 10 reps if you're feeling like you're not being challenged and also you're getting stronger. Now the last exercise I'm gonna recommend here is squats with a weight. Call these goblet squats because you're gonna hold it really close to you. So as close as you can, I'm just gonna cup it into my palms here, right next to my chest, so that way I have good control of the weight and it's easier for me to lift. From here, I'm gonna have my feet about shoulder width apart. I can have my toes turned out a little bit, that's not a problem. Not all the way, right? But just slightly turned out here. And I'm gonna lower myself down to whatever I can tolerate. Now, obviously I don't expect you to get all the way down to the floor if you just had a knee replacement, but that might be 90 degrees. That might even just be about 45 degrees. Either way, we're gonna get great quad activation out of this exercise. Same as those other exercises, 3 sets of 5 to 8 reps. You wanna feel a challenge here. So if you have a weight available to you, if you have a gym, these are the ways that you're gonna build resistance to build up that quad strength after having your knee replacement, when you've been stuck with your knee not straightening when you walk or just having pain when you're walking. This should help with that. Now, in terms of how often to do these exercises, I want you to shoot for about 2 to 3 times per week, right? So if you're doing 3 sets of each, 5 to 8 reps of each set, then you should be getting sore if you're challenging yourself enough to really stimulate that muscle to grow and get stronger. That should be enough to get the strength up. During the other days of the week, just kind of relax, walk, stay active, but don't overexert yourself. Again, 3 times a week, 3 sets of each exercises, 5 to 8 reps per set.